Greetings, and welcome to my dissertation defense presentation on teacher compassion fatigue in predominantly underrepresented classrooms. First, thank you for taking the time to read my dissertation manuscript, listen to my presentation, and share your immeasurable perspective and guidance to improve this work and support my doctoral studies. I acknowledge and appreciate this support. This presentation will review this study's problem of practice, the purpose of the study, the research questions, methodology, results, and recommendations. The presentation will highlight the changes implemented after the proposal defense to accommodate real-world events and maintain a focus on the study despite emerging challenges. The presentation will close with a discussion of the interconnected recommendations that could be applied and adapted to meet the needs of any educational institution. For this study, colorblind ideology is defined as a sociological ideal that limits the influence of race and ethnicity on personal experience. Racial socialization trauma is defined as trauma from experiencing or witnessing racism and discrimination. Behaviors and emotional experiences linked to racial socialization trauma mirror those experienced by extreme trauma victims and often appear as a post-traumatic stress disorder. This study sought to address the problem of practice suggesting that if colorblind ideology, generally practiced in the public school system, prevented teachers from recognizing, naming, and managing the behavioral indicators of race trauma, they were likely to experience secondary trauma, a precursor to compassion fatigue. Compassion fatigue is the emotional stress and exhaustion associated with exposure to a traumatized individual. It may lead to emotional suffering, preoccupation, physical pain, ambivalence, indifference, and depersonalization. The literature review, presented in the second chapter of the dissertation, discusses how the juxtaposed factors of colorblind ideology and racial socialization trauma in classrooms may limit teacher motivation and student performance. However, little research has been done to understand if such classroom dynamics lead to teachers' compassion fatigue, constraining relationships between students and teachers, furthering the challenges of mixing colorblind ideology with underrepresented student experiences. This study attempted to understand if teachers working with predominantly underrepresented student populations describe the effects of compassion fatigue that could impact their motivation and their students' academic performance. To understand this problem, I established the following research questions. It should be noted these questions reflect a qualitative study and differ from the original questions from my proposal defense that intended a quantitative study. Therefore, rather than asking questions to ascertain the proportions of teachers expressing compassion fatigue and the extent to which colorblind ideology may limit their work with underrepresented students, these questions focus on understanding described experiences to help me apply quantifiable results to hard-to-quantify behaviors. First, to understand if teachers' colorblind ideology limits their ability to recognize the impact of racial socialization trauma on students' behavior, this study asked, how is colorblind ideology evident in teachers' assessments of underrepresented students' challenging behaviors? Second, to understand if the missed opportunities to name and mitigate racial socialization trauma results in teachers' compassion fatigue, this study asked, what indicators of compassion fatigue do teachers express when teaching underrepresented students? Finally, to understand if teachers have access to resources that address compassion fatigue, this study asked, what do teachers describe as the mechanisms available to them to address compassion fatigue? The initial methodology proposed for this study was a quantitative survey approach that intended to collect 900 survey responses from the 9,000 teachers working for the Charlotte-Mecklenburg School District in Charlotte, North Carolina. The district was selected because disparities in minority student and dominant student performance that favored white student success suggested colorblind practices. However, the district limited dissertation studies, even non-intrusive studies such as surveys, due to COVID. It would not consider distributing the survey until February 2022, which was too late to complete the current dissertation. In response, I selected another district with similar exemplified evidence of colorblind ideological practices and predominantly minority student populations with disparate student performance outcomes. To protect the anonymity of the respondents, the district was given the pseudonym Southeastern Regional School District. A gatekeeper for the district shared the consent information with peers, finding 5 teachers willing to participate in a 45-minute interview session. Teachers were asked 12 questions based on a tested, valid, and reliable series of questions. The original prompts were designed to understand teachers' beliefs about diversity and modified to fit the focus of this dissertation. Previously selected and organic probing questions expanded on responses, helping me answer the research questions. Zoom meetings were transcribed in real time, and transcriptions were coded based on a priori and open codes to discover themes and performance gaps. The coding and analysis process revealed 3 primary themes: resources and support systems, individual teacher capacity, and fatigue culture. The resources and support systems themes showed that teachers lacked formalized tools and materials available to help them identify indicators of racial socialization trauma. In fact, teachers did not use any formal social, emotional, or mental health assessment tool. The individual teacher capacity theme showed that teachers' worldview about trauma, social emotional development, and race-related understanding are directly connected to their learned experiences, suggesting they respond to race-related or other trauma from within those boundaries. The fatigue culture theme was a definition created for this research study and based on teachers' interview responses, suggesting that they accepted fatigue as a normal part of their workplace experience, exemplifying complacency when describing the emotional exhaustion and compassion fatigue they experienced. The gaps emergent from these themes evidence that teachers lacked formalized assessment tools to identify, name, and respond to race trauma or any other form of trauma or behavioral challenge. Without access to formalized tools, teachers leaned into their personal and professional individual capacity to develop plans. Interview responses demonstrated they upheld a colorblind worldview, and while responses also described evidence of race trauma, because they did not have access to a formal tool to identify race or any trauma, teachers did not describe responding to such issues using a coordinated approach. And while evidence of compassion fatigue was identified, teachers were more likely to associate their fatigue with the COVID crisis. Specifically, teachers described fatigue at a personal and organizational level, affecting every individual they worked with and served. Therefore, the research could not deny that COVID fatigue was a confounder of this study. Despite this confounder, teachers described colorblind ideological practices and students' experiences commensurate with racial socialization trauma. Therefore, while COVID was a confounder, making it challenging to unravel compassion fatigue associated with racial socialization trauma from COVID trauma, the research indicated the classroom's anticipated factors and teachers' expressions of compassion fatigue were present, validating the study's proposed problem of practice. I developed 3 interconnected recommendations meant to create change at the organizational and classroom levels to address these themes. The first of which is to adopt a social-emotional assessment tool that assesses mental health factors at both systemic and personal levels. While the Collaborative for Academic, Social, and Emotional Learning research-based assessment tool displayed here was selected as an example for this dissertation, there are other tools like this that can produce the same outcome. That outcome will be an assessment of the collective impact of family, community, school policies, and classroom practices on students' mental health expressions, allowing teachers to use these data to promote healthy social-emotional growth. The tool would be administered 3 times per year at beginning, midpoint, and close of year checkpoints, helping teachers measure emotional growth from the racial, physical, and socioeconomic perspectives. Trauma associated with these perspectives will be key indicators of students' ability to meet and exceed age-appropriate emotional growth milestones, likely to result in improved academic performance. The incremental checkpoints will help teachers measure progress over time and determine the effectiveness of their response plans. My second recommendation is for teachers to meet twice monthly in community of practice sessions for the entire school year. One of these 2 sessions will be driven by an agenda pulled directly from the social emotional assessment tool outcomes. Teachers will lead these sessions because member leadership is a proven key component of success in communities of practice, suggesting that when the learner also serves as the leader, the community has greater chances of long-term success outcomes. The sessions will allow teachers to collectively leverage student, teacher, and classroom success indicators to address gaps and improve classroom practices. Each session builds upon the one before, placing students' emotional development as a key performance indicator of overall academic success. Although this study could not definitively connect teachers' expressions of compassion fatigue with racial socialization trauma, it could not be denied that racial socialization trauma was described, and responses to that trauma were not. Colorblind ideology was also evidenced in teacher responses to these traumata. While very general descriptions of self-care mechanisms were discussed, teachers did not describe capitalizing on these mechanisms. Moreover, systems to address the unconscious bias that underscores colorblind ideology or organization-wide systems to mitigate the associated compassion fatigue indicators found in the described fatigue culture were also not discussed. To remediate these identified challenges, the twice-monthly community of practice sessions will rotate focus, with one addressing the practical implementation of data-driven social-emotional support systems described on the previous slide. The other will incorporate reflective supervision sessions into discussions. The community will leverage the skills of on-staff counselors who will support the reflective supervision process designed to encourage participants to consider their role in the success and challenges they experience. This will include aspects of self-awareness, helping them consider how their classroom practices sustain colorblind ideology and prevent underrepresented students' race trauma from being named and addressed. These reflective supervision discussions are crucial as they intentionally work to reduce the factors likely to result in compassion fatigue and fatigue culture. The recommendations are designed to bring about the most success when implemented together, incorporate administrator support, and encourage teacher buy-in. However, any effort to name and acknowledge these classroom challenges is a step toward equitable classroom practices. Thank you again for your time, and I look forward to your feedback.